As we're really pleased that the mayor could join us today. He has been our mayor since 2016. This is his second term. I don't think he needs much of an introduction. I just want to personally thank him, as well as the entire council and the health department, for their leadership during this long year and a half of COVID, which is not ending anytime soon. Thank you, Mayor.
Thank you, Alice. And it's so great to see so many friends here. Can everybody hear me okay? Great. Well, it's again, I appreciate the opportunity to be with you. And, let me just make a couple opening comments, because I go back 35 years with many people on this call, starting with Professor David Leuthold, who was my political science professor and advisor. It's great to see you, Professor. I don't know if you're in Columbia or Wyoming, but I'm glad you're doing well. And Al and Mary Jo Tacker, who gave me one of my first opportunities right after college to work in Jefferson City with alcohol and drug treatment providers. And it's something that I continue to work on, and it's an honor to make that a priority as mayor, and I'll visit about that a little bit later as well. And of course, my mayor pro tem, Carl Scallett. It's such an honor to serve with you and to have you seated at my left hand. Of course, I had Pastor Ruffin on my right hand, and it's just I can't imagine going through the last year and a half without you, Carl. So thank you. I thought it was especially important now, and when Alice made the initial invitation earlier this summer, things were looking a little bit better, and I thought, oh, how timely for us to look back at the last 12 months, last year and a half, and kind of give you some of the behind the scenes look at some things that maybe you just read about in the paper. And I still want to do that, and then talk about where we are right now with respect to not just vaccinations, but hospitalizations and unemployment rates and things like that. And then where we're headed, and kind of the resiliency, if you will, of Columbia as a community and of our economy. If serving as mayor during a pandemic year is anything, they should probably count that like dog years, because it's felt more like 7 years that we've been dealing with this pandemic. And as I was putting my thoughts together and kind of organizing, what the last year and a half was like, gosh, and I'll give you a couple examples here coming up, but what seemed like weeks between us doing something and the state of Missouri doing something ended up being days. And when I went back and actually checked the calendar, and it's fascinating to me how much this in all sense of the words, this novel coronavirus, this new coronavirus that we didn't know a lot about, that we were learning about every day, informed our decisions. And let me first by saying, and I appreciate your acknowledgement and thanks, Alice, but let me thank you. It's our community that needs to be thanked for following the advice and guidance of our public health professionals. And this job, my job, our job would have been much harder if we did not feel like we had the support of our community. And I won't say that everybody was happy at all times. I'm not sure anybody can be fully happy about this. There's probably people on the left that want us to shut things down again, and there's probably still people on the right that want us to, or that think the whole thing is a hoax. But I take great pride and sometimes great pain in being a nonpartisan mayor. I spoke to the Boone County Republican Central Committee on Tuesday night. And so in addition to the mayor, I'm also the bravest man in Boone County. I think one of the things that we did well early on was adopt these values that we're going to follow the data and the science, not public opinion or political pressure. And we leaned heavily on great public health professionals like Stephanie Browning and her team. But we're also blessed to have 3 premier healthcare institutions here with Truman VA Hospital and MU Healthcare and Boone Hospital Center. And, being on the leading edge of a storm like this really gives us the opportunity to lead. And sometimes it's also a disadvantage because as you probably know, at one point, 75% of our hospitalizations were from counties outside of Boone County. And, you know, we'll get into some of the other things here, but, you know, and Carl, you were with me that, and I want to say it was probably January 25th, 26th, we had a press conference with council. And I remember saying and talking to Carl, there's an old line from Vietnam where fear is more contagious than reality. And at one point I thought, you know, as these first cases were appearing in Washington, D.C. and Washington state, that fear was more contagious than the virus. Boy, it didn't take long before we reconsidered that. And as quickly as the first part of February, I convened what eventually became what I called the 333 meetings. It was our three hospitals, Truman and Boone Hospital and MU Healthcare. It was our three universities and colleges, Stevens College, Columbia College, University of Missouri. And it was our public health professionals, our police, and our first responders. And we put them all in the same room and we looked at the data and the science. We looked at the modeling, if you will, of the exponential growth of this type of virus if there were not mitigation efforts. And, you know, we stood up at that first meeting at the end of February, around February 25th, 26th, and we committed then to do a few things. It was this unprecedented partnership, this collaboration. We had never made decisions like this as a community before because we've never had a threat. And I can tell you personally, as mayor, the day after I was elected, there's a few things that go through your mind. I remember bringing in the city manager and the police chief and the fire chief, and I said, I don't need to know what the plan is, but if there's a catastrophic tornado, I just need to know there's a plan. Yes, and I was assured, yes, there's a plan. You know, and then your mind as mayor races to the next national tragedy, and it's, you know, macabre to say, but you know, what if we had a school shooting here with national media attention and loss of life and officer involved shootings? And while it's macabre to think about that, you do think about, well, yes, we have 3 days of you know, intense media coverage, and then we start that hard work of rebuilding, whether it's a school shooting or a tornado. This COVID-19 was like that type of tragedy rolling out every day, every week, every month here in what, Alice, in our 15th, 18th month at this point. I mean, and at some point it required every bit of that amount of energy. But we committed at that first stand-up press conference and what eventually became a regular community briefing with our university president and healthcare professionals and incident command at our hospitals to follow the data, to follow the science, to be panicked, to be prepared but not panicked in how we address these. And I'm glad we did. It was kind of that first meeting on February 25th, 26th, when I also reminded our community to remember its values. We had the True False Film Festival that very next weekend, that first weekend of March, if you will. And we would have a number of visiting international filmmakers here, many from Asia and China. And, you know, I didn't have to remind our community that we need to be respectful vis-a-vis all the other anti-Asian, and you had a national figurehead at the time referring to this as the Wuhan flu or the China virus. We didn't do that here. And I think that also paid dividends, not just on the front end of this, but remembering those who's, you know, not just our healthcare providers, but our families who, you know, may not have health insurance, may not have the ability to take off work if they test positive and have to quarantine, if they get paid by the hour and have 14 days with no hourly income. So all of those issues we we considered as we on the front end of this, and I'm glad we did. I can tell you after we finished, and for us, True False was an annual tradition, but I was nervous. We were wearing masks. We had hand sanitizing stations at the time. We were doing some of those things at the very beginning that were unfamiliar, if you recall, in terms of social distancing wasn't a thing yet. And I remember being very relieved on March 14th when the health director called me and said, just want to let you know the incubation period for True False has expired and we had no positive cases. But that was not a time to sit back and rest on our laurels. And going back, and again, this is all kind of a blur, but I went back, and if you may remember, on March 16th, Carl, the city manager asked us to pass a resolution authorizing him. It was already his authority to adopt an emergency declaration to declare a state of emergency in Columbia. And, our charter was written in what, the 1950s, 1964 maybe, giving the city manager the authority to declare a state of emergency. I can't tell you that it had ever been done. It had certainly never been done on such a lengthy basis. It was just lifted a year later. Almost in June of this year is when he lifted it. But we passed a resolution authorizing him to do that. He issued the declaration of emergency on March 16th, on a Monday. By Tuesday, March 17th, Boone County had its first COVID case. By Wednesday of March 18th, our first COVID case became our first death. And I was in the car on the way to Jeff City to announce it with the governor. And it also ended up being the first death in the state of Missouri, right here in Boone County. And so for that first 3 days of this, I didn't sleep and spent most of those 3 days in the mayor's office with, if you think about what a war room or a SWAT room looks like, it was that, except with IT professionals and public health officials, making these decisions as we go, and then putting together, again, that 333 meeting. I remember Gary Ward, the Vice Chancellor for Student Affairs, calling me in March and saying, Mayor, I just want to let you know, we are not going to close this university absent some local, state, or federal order. We are going to stay in seat. I'm like, okay, I'm glad thank you. And it wasn't 2 days later that he called back and said, Mayor, I want to let you know that we're closing school. There's too much gossip and rumors on campus. Spring break is next week. There's already rumor that there's a positive case on campus. And we are going to dismiss for spring break early, and we're probably not coming back. And if you're the mayor of a college town and your university, which is filling up 4,000 apartment beds, downtown and thousands more everywhere else, and parents' weekends and graduation weekends, and you hear that the university is closing, although he was quick to tell me we're not closing, we're suspending in-seat classes. You begin to get a sense of what it was like in 1893 when University Hall, Academic Hall burned down, and we're even wondering if there's going to be a university in Columbia, Missouri. But we made those decisions together, and I think by communicating them with one voice, with both Stevens College and Columbia College, we got the language right. And I think one of the things in retrospect that, and this is what I'm about to say is not a political statement, but it didn't have to be this hard. Absent consistent state and federal leadership, that, if you all remember the Bob Woodward interview with the president at the time, that, he knew it wasn't a hoax. He knew it was not less contagious than the normal flu, or that children could be affected. And that's not a political statement. It's just, there's no playbook for this. There's no, well, there is a playbook. I'll tell you about that. But I think where the public, where we undermine public confidence in these decisions, it's when the bars are open in Illinois, but you cross over in the city of St. Louis and they're not. And you go into the county and they're open, but they have to close at 10. And then all the way until you get to Boone County, there's no public health order whatsoever. You've got meatpacking plants in California and Saline County, all coming here to use our hospital. And we're protecting ourselves, but those counties aren't doing that. And it confuses the public, and the public is left wondering, what is the data? What is the science? What am I supposed to do? I mentioned there's no playbook for the decisions that we made. In fact, there was a playbook. Every 10 years, the health department is supposed to update an influenza manual. Alice, you probably know about this. And I remember being in one of those 333 meetings when, when I had the former president of Boone Hospital there, which was under, still under control by St. Louis BJC. So they were really making Columbia decisions based on what was happening in St. Louis. But I remember asking the president of Boone Hospital at the time, what do you do if we have to quarantine and have COVID floors? He said, well, our influenza plan says that we're using Stevens College dormitories for that. And the president of Stevens College was sitting right there. And I said, did you know that, Diane? And no, we're using those dormitories to quarantine students that, and so even our playbook for a traditional influenza outbreak or pandemic, wasn't operable at the time. And at best was from, 2008 for what we were dealing with. But look, we got through spring break, and by March 24th, we were looking at a stay-at-home order. And again, this was, as we were meeting here locally with those 333 meetings and making those decisions together, I'm meeting with my counterparts, the mayor of Kansas City, the mayor of St. Louis, the mayor of Springfield, and regularly with the governor. And what we were seeing on the ground in our communities was much different than what he was seeing, with the density of Missouri. And he, I will tell you, he did respect local control to do. He said, I'm going to do what I need to do, but you need to do what you need to do. And to me, it was that first feeling that we're on our own here, and we're going to have to make the best decisions we can for Columbia. And I would dare say Boone County, although at the time when you had a presiding commissioner who inspired a lawsuit against the very public health order that he voted on, again, that creates confusion and distraction when we're trying to do our things. But one of the examples of a pandemic being like dog years, Columbia issued a stay-at-home order on March 24th. And, it was in conjunction within 24 hours of St. Louis and Kansas City. And, this was never a race. We were always trying to do what was best. And if anything, put off what we had to do. But in retrospect, I think we made everything timely. Springfield may have gone first on the stay at home, and then Columbia. I know Columbia went first on the mask mandate in June, followed by the others. And but I think at the time, if you remember, all the pressure, Missouri and Florida were the last two states without the governor issuing a stay at home order. And in retrospect, you would think, gosh, weeks and months must have gone by. But Governor Parson issued the stay-at-home order in Missouri on April 3rd. So, from March 24th to April 3rd, we were doing, we had our public health order, but in retrospect, it just seems like weeks went by before the state caught up to us on those. I always said, going through this, that public health protections and coronavirus is not a switch that you flip on and off. It's a dial that we turn. And when we see cases rising, we ask ourselves, are cases going up? Yes. Are they manageable? Yes, for now. And when they become less manageable, then we turn that dial a little bit, whether that's the other mitigation techniques, things like that. I happen to be traveling in the summer into another state that had mask protections. And I saw how comfortable, how confident, when everybody was following the same rules, how easy it was. Waiters would greet you with a Ziploc bag, and I was like, what's a Ziploc bag for? That's to put your mask in after you sit down. They already had digital menus at the time there, something that didn't come to Columbia until, it seems, again, months ago, year ago, was it a year ago? Much later than where other states were in this. And I remember having a conversation with, well, it was Matt Jenny, who owns Addison's and Sophia's, about the mask mandate. And, you know, there are other, I wasn't too popular with bars and restaurants for a while. And one of the things that that Matt told me that made me feel better about this was that when government mandates it, it levels the playing field for everybody. And he said, for me, I want to have a mask mandate here, but if my competitor, the restaurant across town, is not doing it, I might lose business because they're going there, or I might lose employees because they know they don't have to wear one there. When you level the playing field for everybody, it makes it easy for us all to comply and focus on the other things that we need to be doing instead of arguing about this. And you know, that was a bargain I was willing to take. The city can take the heat for that if it meant giving not necessarily business owners, but the consumers the confidence they need at the time after that shutdown to kind of turn that dial back, to have some of those protections in place. And I think when you hear Rick Robertson at Buch's, who was, you know, pretty mad at me for a while for the first week of the mask mandate, and then he saw customers that he hadn't seen for a while coming back because they had the protection they needed to venture back out on the economy, or Shakespeare saying we had our best week in 6 months here because people feel comfortable getting out a little bit. I think that was helpful. You know, but it was also done during a state of emergency. It was also done with the blessing and request of the public health director. I'll make a comment about that because it's now state law, but it was actually the city of Columbia that, you know, before in a state of emergency, the public health director has profound powers in our city charter to issue orders of quarantine or stay at home. It was more done for contagious diseases. If you had one person that was maybe contagious, she could order the director. And I will tell you that the other thing we changed in our charter, in our ordinance, by the way, the health director is always referred to as a he in the city of Columbia, but we have now changed that to be the health director and remove any gender. We've gone to all gender neutral language there. But I don't know that anybody ever anticipated, going back to 1918, that we would have this type of wholesale stay-at-home order. One of the most effective things that helped me get through this was when Steve Sapp, who's a bit of a historian and our former spokesperson for the city of Columbia, went back and pulled all the headlines from the Columbia Statesman and the Columbia Missourian, and it wasn't the Columbia Daily Tribune at the time, Columbia Evening Standard, from 1918. In the order, in the chronological order, everything from Mizzou canceling its football game with Washington University. I didn't know we ever played WashU, but canceling it because of the pandemic, to churches closing because of the pandemic, to people wearing masks. And it was eerily familiar how history was repeating itself and rolling out almost in the same increment with, and even right down to the xenophobia. We called it the Spanish flu at the time. You know, it wasn't, and it was as offensive then, or should have been as offensive then, as China flu or Wuhan flu would have been today. You know, as there are a couple of things that I think really made Columbia unique about this, both in terms of the unique characteristics of our community, but also things that we did first that no other community were able to do. Obviously, we have a huge student concentration, and that's a very migratory population. They don't all live in student housing on campus anymore. They're in private, you know, off-campus housing that the university and doesn't have control over. The university or the city has a little bit of control over. We also had a huge bar scene, and you know, it's kind of hard for me to be able to tell bar owners that, look, if your business model relies on 400 college kids coming in and paying a $5 cover for all they can drink till 2 a.m., that's probably not going to work for you right now. It's just not safe to do so. But I also need to brag on our hospital's incident command here. And you think about the need for an incident commander, maybe in times of trauma, mass trauma, or war, or mass casualty event like a shooting or a tornado, and they staffed up exactly like that. Mizzou quickly stepped in and had the first drive-through testing site in the entire state. And I think that paid dividends, but we did one better than that. Every other health department at the time had to send their tests to the state health lab and have the state health lab run those tests and then send the results back to the county health department or in the county of residence where the person, so if you lived in Saline County, got tested in Columbia, that result got sent back to Saline County. And that added a couple more days. And then when you start thinking about 114 counties overwhelming the state health department with that, I was able to get the governor and state health, Randall Williams at the time, to sign off on, because we have a healthcare infrastructure in Columbia that no one else does, maybe outside of St. Louis. We had Boyce and Bynum. We had a new genetics testing lab here that was able to process our COVID tests within 24 hours. And so we got permission to not only run the tests here, process the tests here, keep the tests here, and then send our results to the state health department instead of sending the actual testing specimens to Jeff City, waiting for them to test. And it paid huge dividends, because keep in mind, think back to where we were. If you could even find a test, then you had mass testing. And then what are you doing? You're waiting around for 24, 48 hours for that test to come back. Do I go out? And not everybody had the luxury of staying at home waiting for that. But if they did, they were losing income. The best thing we could do is let them know if they're positive or negative as quickly as possible. And we did that. So I think that that model worked so well. And I'm so deeply appreciative for both Boone Hospital and MU Healthcare for doing that. And, they did it on Boone's parking lot. They did it on the athletic department parking lot. They did it on the back parking lot of the old Ellis Shell building. And we could do thousands of tests a day, because testing and isolating was one of those mitigation techniques that really paid big dividends for us. It was that same format, if you will, that allowed us to quickly pivot when the vaccines became available. Then the challenge became, how do we get enough vaccines here in Columbia to be able to do that? At one point, MU Healthcare had the capacity to do 25,000 vaccinations a week. They could do 5,000 a day if they just had the inventory. And one of the things that I think the mandated masks helped us do is buy us time until those vaccine inventories were available, until we could reduce those waiting lists, until we could get people eligible. But I remember calling to the governor's office and saying, hey, what do we need to do to make Boone County more attractive for excess vaccines? And he said, if you could have a list of people, like we send, we try to divide the vaccines proportional to the state geography. But if we send 1,000 vaccines to Howard County and they only use 800 of them, they have to use the rest of those within 24 hours of opening that box. If you told me you had 200 people in Columbia that could show up within 24 hours to get that vaccine, we could move that quickly to you. I'm like, we can do that. And I called Peter Stiepelman. I said, can you find, and this was at a time when not every teacher was eligible. We were still at the 65 and over category, or special health conditions. If you could have an email list of people signing up that if vaccines become available, if they can show up within 4 hours notice, we can do it. And, it was those types of quick thinking that really allowed us to get as many people vaccinated as quickly as possible. And, I haven't checked today, but Boone County continues to have the highest vaccination rate of any county in Missouri. I dare say if we when you look at, and I asked Stephanie Browning for this data on the slide at Monday's meeting, for those people who are, check my notes. So get this, for those people who are 50 and over, we are at 64.75% vaccinated. For 70 and over, 77% have been vaccinated. For 80 and over, 93%, 0.79, almost 94%. So our most vulnerable population, and when you look at those, everybody 65% and over, 86, 87% have been vaccinated. That's incredible to me. And the other thing that I'll mention, given the current environment that we're in, is that there's a direct and disproportionate correlation between vaccination rates and hospitalization rates. We've had no one hospitalized in Boone County who has been vaccinated. And to me, the more that we can preach that, the better. One of my concerns about the current mask debate is that it distracts us from the vaccination dilemma and the vaccine hesitancy that we're all trying to understand. If there's anybody on this call that hasn't been vaccinated and can be vaccinated, please, please, please go get vaccinated. It's the best protection you have. I was with the mayors of Kansas City and Springfield Wednesday for a luncheon with the governor, and I visited with the mayors afterwards, one of whom is considering a mask mandate and one that is not, and Columbia in the middle of this debate. And Ken McClure, the mayor of Springfield, Matt Blunt's former chief of staff, was telling me that one of the best phone calls he made was to all the churches and pastors in Springfield. And he asked them to preach from the pulpit the importance of a vaccine. And one of the pastors said, well, I'm not going to take that heat. And he said, there's no one that's taken more heat than Ken has in the last 12 months. You are opinion leaders, and your flock looks up to you, and you have to tell them to have faith in this vaccine. And I called a pastor here in town at First Christian Church, and I've asked Stephanie and Verna LeBoy, who has done great work with her Live Well by Faith initiative. Again, one of those unique things about Columbia that I think paid big dividends. It was really about diabetes when she started it, but it was those relationships that helped us get into the church community. And it's kind of like that old parable of the drowning man who, his house is flooding, and he prays to the Lord, please help me. And he climbs up on the roof and says, please, Lord, rescue me. And a boat comes by and says, get in, we'll take you to safety. No, I'm good. I'm trusting in the Lord. He's gonna rescue me. And then a helicopter comes and drops a rope, says, climb on up, we'll save you. No, I'm good. The Lord is going to protect me. And the man perishes. And when he gets to heaven, he asks the Lord, trying to reconcile what happened here. Lord, why didn't you help me? And he said, well, I sent you a rowboat and a helicopter. And I think in the same way, we have talented researchers and medical scientists and doctors and physicians that have come up with the best protection we have right now. And we just need to encourage everybody to get vaccinated. As we look at how we begin to pull out of really the first 12 months, I'm just so proud of our community. And I'll give you a couple examples. And you all probably know it's overwhelming sometimes when you think about some of the stories that come out of a pandemic. And I think specifically about Dave Johnson at Broadway Diner. When we did the first stay-at-home order, he had all this perishable inventory that was, he could put it back in the freezer, but some of it just was going to go to waste. And so he started free lunches and free breakfast for kids whose only warm meal they got at school. And probably started as word of mouth, then Twitter, then Facebook, and then, just in the amazing community that Columbia is, it eventually becoming that Kids in Need Diner program, where to this day, Dave Johnson continues to provide a warm breakfast and a warm lunch to kids who need one. And in retrospect, his regular customers that would come by that would also order and be served out that window that has a bit of a dubious past, would give them $50 for a $10 breakfast and say, pay it forward, and so he started the ability to keep those kids fed who really needed it. And from small companies like that to big companies like Veterans United, every day they would buy through a local restaurant 100 lunches, and then they would donate those lunches to either nurses or our homeless shelter or our first responders or our firefighters. And those blessings really paid big dividends, not just in the restaurant owners that had work for that day, but the people who received those meals. And Veterans United never wanted recognition for that, but it was one of those things that they've kept a lot of people safe and fed and economically stable for a while. So, and I remember at the time, I'm sorry if I'm rambling, this is a bit cathartic for me as well. I remember at the time saying to my wife, I feel like we're really stretched thin, that our bandwidth for handling this pandemic or anything else that comes along is really stretched. And then the George Floyd tragedy occurred, murder, and in Minneapolis, and that initiated 200 days of protests, some small, some large, here in Columbia. And if we weren't already in the middle of a crisis, we now had another layer of crisis here. And again, I'm so proud of our protesters, but also our police and our community for how it responded in that, to listening. And again, those relationships, those conversations that we started at Second Missionary Baptist Church shortly after I was elected, meeting monthly with the NAACP and our police about, civil discourse and disproportionate minority contact and all those issues. That dialogue paid big dividends in terms of how we were able to handle that crisis as a community as well. A lot has happened as we begin to pull out of this second surge. I remark about how fortunate we are in some cases. The council pivoted quickly. We've had several rounds of federal funds, either directly through our public transit cost share with the federal government. We were able to suspend bus fares last year. We've kept that going this year to help people get around and get around safely. We were in April of this year, we went out for bonds on the new airport terminal, $30 million in debt. That was all backed by hotel room nights and passenger fares, neither of which we had at the time. And to think about flying being an act of faith, I can tell you that going into debt to build an airport terminal when planes are grounded is also an act of faith. But we were able to convert some additional federal funds to back those bonds and to help pay off that airport terminal sooner than later. We've had CARES Act dollars that are allocated. We've spent millions of dollars helping those who are unsheltered, provide, and look, solving the homeless crisis is difficult in normal times. Doing it in the middle of a pandemic is even harder because of the social distancing requirements, because of the cleanliness, hand washing requirements, and some of those things. But I think we're making big dividends and big gains in that. Which leads me to the American Rescue Plan funds. Columbia is set to receive $26 million in American Rescue Plan funds. Half of that has already been received. And I think this really gives us an opportunity to look at the haves and the have-nots in our community. Not just those who have access to healthcare and those who do not, those who have access to childcare and those who do not, but those who have access to technology and those who don't. And I think there's a couple key areas here where a majority of council can agree. And one of those, of course, is the homeless population. But it's not just the unsheltered, and it's not just for the unsheltered or for the chronic homeless. Columbia really lacks a shelter for anybody, whether that's a utility outage or winter weather event, or a cooling center during the hot summer months. And I think more than ever, this has illustrated to me the need for some type of place where we can house people safely. We can argue about, is that $1 million? Is it $3.5 million? Is it 20 beds or 200 beds? But I think you're going to see something come out of this American Rescue Plan funds to have, whether that's the Opportunity Campus that the Voluntary Action Center is proposing, or a day center, drop-in shelter where people can come and have a warm meal and a cot and a place to shower. We're in the middle of those discussions now. I think the other thing that has come out of this is just the mental health needs in our community. And when I was running for re-election, well, even back in 2016, I've always said Columbia needs a place that is neither an emergency room nor a jail cell. And for our police officers, they run about 600 calls a year that require some type of law enforcement referral to MU Healthcare. That doesn't even count the people that we're sending to Boone Hospital. So about 600 calls a year, about 40% of them are the same offender more than once. And one of the lessons I've learned from the city of Springfield is this behavioral crisis, or what's called a rapid access treatment center. It is a place where law enforcement can take someone who is in crisis. They can become stabilized. They have some immediate peer counseling. They have a place to clean up. And we sort this out. It's like a 24-hour social detox, and Mary Jo and Al know what I'm referring to. But that has really reduced what used to take 2 police officers sitting in an emergency room for 6 hours. They've now got down to 19 minutes. And that person can be seen by a mental health professional, stabilized, and we sort out, if the crime occurred, we sort it out tomorrow. If it's just a medication issue, we get them stabilized and back on their treatment plan with some follow-up care that keeps them out of that incarceration in civil justice, criminal justice system. So I'm optimistic about that being one of those priorities that come out of those American Recovery Plan funds. And I think the third is looking at those who are unemployed or underemployed in this pandemic. Look, Zoom calls are probably not going to be just a phenomenon of COVID. Some of that is going to be with us for a while. When we go back to main big events at hotels, I'm not sure, but there's a lot of people that I think would benefit from retraining. And Moberly Area Community College has several opportunities. They say our Route B manufacturers cannot hire enough industrial electricians. These are good paying jobs, $80,000 a year jobs, if they just have some type of industrial electrician training. So Moberly Area Community College has the third phase of its mechatronics program, where they can turn out as many graduates, where those Route B high-tech manufacturers can hire as many graduates as Moberly Area Community College can turn out. And I think that is a great investment. The other thing that I think could be a game changer for the next generation is early college, and having the ability for every high school senior who graduates CPS to also graduate, who wants one, with a 2-year associate's degree from Moberly Area Community College. I can tell you our son just graduated from college, and the opportunity to save 2 years of college tuition would be a big deal. It'd be a big deal for a lot of families, and something that would set our next generation on a firm footing, whether they go on to a 4-year degree at Mizzou, which would accept all of those credits, or enter the workforce. I think we're preparing that next generation of workers. So I hope as council continues to debate this through the budget process, that some of those things get across the finish line and we can get started on those. I don't think we can afford to wait when it comes to our unsheltered population, or our mental health population. So, looking ahead, I'm so glad, you're probably giving me the hook, Alice, but I'm so glad that we have had the projects, the capital improvement projects in the pipeline, not just the $38 million airport We have a $230 million Roachport Bridge that's paid for in part with local, state, and federal funds. We've got the Next Gen facility that is going to be cutting the ribbon on here in October. That's really going to change healthcare over the long haul. But, for me, those are great, good paying construction jobs, and people that are going to come here to Columbia to work on those facilities and work on that bridge, that are either going to bring their families here to live here, and some of them are going to stay here. And I think for a workforce development initiative, it really places Columbia on a firm footing for everything that we're doing. So I am so grateful to each of you for what you have gone through in the last 18 months, for following the advice of our public health professionals. And we're gonna. I said it many times last year. We're in this together. We're going to get through it together, and together with you, I'm so grateful for your support. So happy to take any questions. Professor Luthold.
Oh, good.
I get to call on you for a change.
Thank you very much for your presentation. That was quite helpful. What's the situation on evictions of renters in Columbia, and why is money coming through so slowly
I think
rent?
Yeah, so the state of Missouri received $325 million in eviction relief through the Missouri Housing Development Corporation. That's the low-income housing arm that helps support the Columbia Housing Authority and a lot of the other affordable housing projects that we have here in Columbia. I think why is the money moving so slowly? 90% of those funds are still available. And I think part of the data they used is from the spring of last year. I think that is moving forward now. There is an online application. I'll try to find it and send it to someone. I know it's floating around out there, that requires the signature of the tenant and the landlord. But look, the landlord should be highly incentivized. No one wants an empty apartment unit or an empty rental unit that they can't lease, and nobody wants an eviction on their record. That eviction moratorium has now been extended, and I hope some of those funds can flow, that there's a more streamlined process to get that in the hands of the people.
Okay, it looks like Carl's got his hand up.
Mr. Scala.
Mayor. Mr. Mayor, it's been a privilege. You had very kind remarks to me. I want to return those in kind. I've now been through 3 mayors and 4 city managers, and you're among my favorites. We've had quite a working relationship, and I don't want to strain this issue too much. Obviously, there's a big meeting coming up on Monday, and I certainly don't want to. Well, I don't. Frankly, if it's more pressure, it's more pressure. But I don't want to put you on the spot about anything in particular. We see this a little bit differently. I've always thought your advice, and I agree with you, to follow the data is sound. It's a wonderful principle. CDC has now established some of that information, particularly with respect to the Delta variant. This is a very different beast. It has much more viral load. It creates a milieu that the virus can multiply in, and so on and so forth. You're well aware of all of this, and so is everyone else on this Zoom call. I think, although I've gotten some email lately, that the anti folks have stepped up to the plate, it's still probably a bit like 2 to 1 for the mandate. And the reason that folks are saying that is because some folks believe that it's defiance if you put this in the face of some of the public. I believe that it's an exemplar to put it in the face of some of the public, and I think we will get as many adherents as we will as defiers. But that remains to be seen, and I know there are some challenges and some hurdles with the legal aspects of this and so on. That's just kind of the way I see it, and I probably, unless some compelling information comes out of the meeting, will probably vote accordingly. But we've learned to deal with each other, generally supporting each other, and occasionally there's been a hiccup here and there. we'll see how this turns out.
When you've been in a lot of those 333 meetings, and you know the discussions that we've had, and you know, we make decisions together so that we can communicate them with one voice, because I do think that inspires confidence. You know, I don't keep track of the emails I receive on public health issues. It's not productive. This is not, I don't want to be persuaded by public opinion or political pressure for that standpoint. I want to be able to follow the and support the public health director and the decisions that she and her department have to make and enforce. I will tell you though, just from a you know, strategic communications perspective that I come from, every minute and hour and week that we spend talking about mask mandates is time that we're not spent talking about vaccines. And I fear that you know, having a long, drawn out public debate about masks and mask mandates distracts us all from vaccines. And if everyone who sent me an email for or against masks would spend the same amount of energy emailing someone that hasn't been vaccinated, we drive that number up where it needs to be. Chairman, Mr. Chairman, Plummer. You're on mute, I think. Mr. Mallory?
Yes, Mr. Mayor, someone who wasn't able to attend today's meeting sent me a note beforehand and wanted to check on the status, I guess, of virtual participation in business and commission meetings. I don't know what we have now as far as the ability to virtually sit in on and participate in those meetings, but that was a concern of this person. And could you fill us in on what the ability we have to participate as citizens without coming in person?
Well, and again, look, we still have a participatory democracy. We make decisions in a public setting, in a public building, under the protections of Missouri Sunshine Law. And when we're under a state of emergency, there was some flexibility there where as long as we had a majority of council members present, and I've never missed a city council meeting, much to Carl's dismay, because he would like to preside every now and then.
Don't make assumptions here.
You know, we've had in-person meetings, and there are some, you know, concerns that I have about virtual meetings in a public setting, not only with the see and be seen requirement that, you know, the person who's testifying has to see everybody that's the decision maker and vice versa. But, you know, are we doing this for convenience? And is it for the public or the convenience of the elected official? I can tell you, it's often uncomfortable being in that room, right? There are people on both sides of the issues. You're not always popular. But for me, it's important that that process is fair and that everyone is treated with respect. And so regardless of whether you agree or disagree with the decision, you know that you were treated fairly, and that someone else with a similar concern is given the same opportunity. I don't know where we're going to go. I think right now the current status is there's a pilot project where they're asking boards and commissions if they would like to consider virtual meetings. It's hard to find a software program that meets the requirements of Missouri Sunshine Law and meets the requirements of the Americans with Disabilities Act, because not everyone can use a computer, not everyone has a computer, not everyone can use a mouse to, you know, click on and off the mute and video portions of it. As someone who has to run that meeting, I've got a lot going on, and for me, we're not running a talk show here. We're running a public meeting. And for us to Madam Clerk, read the bill, is there a staff report? Is there anyone that desires to be heard? Now let's go to the phones. You know, there's a lot of people who watch city council meetings at home, myself included, before I was elected, that gosh, if I was down there, I would tell them, you know, what I really give them a piece of my mind. To allow someone to get on Zoom at 8:30 at night or 10:30 at night from from the comfort of their couch and give us a piece of their mind on something. Look, I don't want to discourage public input, but we also don't elevate one type of public input over another, and we still have, the need for people to come, to a city council meeting. If we're in a state of emergency, I think that's different. If we're social distancing, we've been very good about cycling people in and out. If we're not having public meetings and public buildings are closed, then obviously we need to but we should also suspend those issues that are likely to elicit substantial public comment, so we can just deal with the issues associated with that emergency during that time.
Kathy, did you want to have a statement?
Yes, I want to follow up on your comment about the need to focus on vaccines, and I most certainly agree with that. But I don't think the issue really is an either or. I think we can do masking and vaccines. And I know that I'm not comfortable at all to be out and about with so many unmasked people, because I know even though I am fully vaccinated, I still could get this Delta variant, and it doesn't sound like it's any fun. Probably I would not be hospitalized, probably I would not die, but it still doesn't sound like any fun. And I don't understand sorting it into an either or when it could most certainly be both.
Yeah, and I will tell you I think all of those are mitigation strategies that can be taken together. And the CDC guidance is to encourages mask wearing while indoors when social distancing can't be maintained. I wish social media could be maintained. And I will tell you that is identical to the public health advisory that Stephanie Browning issued 3 weeks earlier on July the 7th. So we are doing what the CDC recognizes and recommends. We're just not mandating it. And you can argue whether CDC can force local governments, whether it's right for local governments to enforce CDC mandates. And for every one of those, I've got a business owner that says, why should we enforce the local government's mandate? So it's a difficult situation, and the law, changes August 28th here in the state of Missouri about that. So.
Okay, Al Plummer, and then if there's time.
Yes. I've unmuted this time. Mr. Mayor, I would like to compliment you and the city council for the leadership you reflected and not allowing the whole pandemic issue to get pulled into the political discussion. I believe politics needs to stay out of science. But I'd like to turn our attention in another direction. You mentioned Floyd's murder, and out of that came what I saw as an opportunity for states and municipalities to put more emphasis on civil and human rights issues, which has essentially faded considerably over the years and drastically in our state. I was wondering, is there any thought or discussion about creating a umbrella agency within city government that would oversee many of the aspects of civil and human rights issues, whether it be dealing with civil rights ordinances or dealing with supplier diversity? I know we have those functions, but they're all in different places. There's no one umbrella to help keep an eye on the whole piece. I think the state of Missouri has really missed an opportunity, and I would like to see the city of Columbia show some leadership in that area.
Yeah, well, great question, and I am so proud of everything our city has done, not just in the last 6 years. And you could go back to, since we're celebrating the bicentennial, some of the early investments in equity that have set our community on a firm path, beginning with Cummings Academy, the first school for educating African Americans to General Richard Gentry's, starting a school for the education of women in Columbia. But more recently, we have a robust Human Rights Commission chaired by Amanda Hinnant. They routinely make recommendations to the City Council that we adopt. We have one of the first citizens police review boards that handle appeals and citizen complaints about our police department and make recommendations. They're very active in our vehicle stop data committee. But just on behalf of Carl and myself, when we hired this city manager, I remember it was January 11th, 2016, as I had my first candidate orientation as a candidate for mayor. And we brought all the candidates for mayor at the time. Skip and I were brought in, and the former city manager had all of the department heads and all of the highest paid employees. And there were very few people of color. And so when you think about one of the things that inspired in me was that we needed a city government that looks like the community it serves. And when we hired John Glasscock, and again, I can't imagine going through the last 12 months, but the last 3 years without John and Carl in making these very difficult decisions, we inspired him to make his cabinet look like the community it serves. And he has hired DeCarlin Seawood, the deputy city, as his deputy city manager to help fill his blind spot. If you don't know DeCarlin, he was a city manager in Ferguson, Missouri. And both before and after the period of unrest. And for him to tell us, we would dream of doing the things that Columbia is doing in Ferguson if we only had the resources. And we have the resources, and we're investing in that. It's obvious in our strategic plan. But if you want to have a more robust and diverse city of Columbia, you have to start at the very top. And so John also hired Dr. Richard Enyard as our HR director. African-American, academic HR specialist, and looks at the hiring process in a different way and is committed to doing the extra work to recruit and retain a robust mix, diverse mix of city employees. Our finance director that we hired from Warrensburg, Missouri, to come over. I mean, I just think we are so fortunate to be making the gains that we have, and that has continued to pay dividends, and I hope it will.
So, Mayor, I would like to get in a quick question if I could. You said follow the data, and there's so much data out there, and I know you're listening to our local health department, Stephanie, but recently this week, the chief medical officer for Boone Hospital System, Robin Blunt, stated she was in support of a mask mandate because of the hospital surges in the Boone Hospital System and lack of ICU beds. And I do know that Stephanie also stated at a meeting, our cases are higher than last February 2021 still. So I'll just sort of put that out there. Thank you.
Thank you. We got time for one more question. Herb?
Thank you very much. Personally, thank the council, the city government staff, the county commission, and staff of the county government and other institutions for doing so well as you have done collectively for us during the pandemic. We thank you all. Thank you also for a meaty presentation. One thing you said you would talk about more later, but didn't get to, was the COVID load on our three hospitals. You mentioned that there was a past high level of out-of-county patients with COVID in the hospitals. I wonder if you could give us the distribution for the three collectively, and whether that differs in any significant way from the out-of-county presence as routinely part of the operations of these hospitals.
Yeah, I don't know if I can do it in the time that we have, but I'll try to find that for Monday's meeting. And my reference was really for most of 2020, we were consistently running 75% of the caseload here in Boone County were from people outside of our outside of Boone County, which is, I think it's one of those things that's frustrating to people, that why are we wearing a mask? Why are we going through a shutdown? Why do we have all these public health orders only to save our hospital capacity for Montauk and Cooper? And part of that, was also, the fallout of the failure of Medicaid expansion 10 years ago. That, we've had many rural hospitals in Fulton and Booneville and Mexico and Moberly. They don't have the same resources that we do. And even in a good year, like 14,000 patients from 25 counties get their primary diagnosis from right here in Columbia. I mean, we're a healthcare destination for people, and that I would assume those numbers are still true today. And I'll try to find or ask Stephanie for it on Monday as we begin to look for those things. Again, it's my pleasure to be with you today. I thank you for the invitation and Alice's patience with my schedule, trying to find a Friday that worked. And again, I'm honored to be your mayor, and so appreciative of the support that you've given me and the entire council, but mostly our public health department over the last 18 months.
Thank you for being with us, Mr. Mayor.
Thank you.
Thank you, Mr. Mayor. Thank
All
you.
right, next, as a